Hi, once again welcome back to obstetrics and gynecology videos. Today we are going to see about the diet in pregnancy. What are the type of diets a pregnant woman is supposed to take? What is the need of diet modification in pregnancy? And in case if you are not giving proper diet to a pregnant woman, what will happen to the mother and for the baby? What are the type of diet they can take? All these things we are going to discuss in this video. If you're thinking about the human body, we know that changes are happening in the body day by day. Our age is increasing, and if you are thinking about a child, growth is happening, and even in the same age group also, some will be having more physical activity, some will be having less physical activity, and some will be having more metabolic rate, and some will not be having metabolic rate. Some may be pregnant in the same age group, some may not be pregnant, some may not be even married also. So the amount of nutrients which are needed for a particular human being depends on these factors, that is age of the person, physiological status of the person, physical activity or changes in the activity of the person, basal metabolic rate and growth rate of the person. And why we need to make changes in the diet during pregnancy? We know that during the pregnancy, the uterine size is increasing, number of cells are increasing, size of cells are increasing, blood supply to the uterus is increasing, heart rate of the mother is increasing, systemic volume is increasing, cardiac output is increasing. So oxygen consumption, everything is increasing inside the body. And even mother's appetite also will change. Sometimes she may start to crave for the unnatural substances, and sometimes she may get constipation. Like a lot of changes are occurring in her body. So for meeting these changes or for getting adapted with these changes, we need to make changes in her diet. And some along with that, she is supposed to meet the needs of the growing fetus, and she needs more energy because her metabolic rate will be increasing, her lifestyle also will be changing, and her dietary habits also will be changing. So by considering all these things only, we are supposed to modify the diet of a pregnant woman. And during lactation also, during breastfeeding period also, we know that a lot of energy is getting released or losing from the maternal body for the production of breast milk, and around 850 ml of breast milk will be producing in a day, and 80% of the conversion of food energy into milk energy. So whatever she is taking, 80% of that will be utilized for the production of breast milk. So during the lactation also, we are supposed to give additional food supplements for the lady. Now we can see the energy requirements during the pregnancy and lactation. Total energy requirements for oxygen consumption is increasing during pregnancy, and it will be 27,000 kilocalories altogether. And she also needs energy for the utilization of fat and protein. And we know that during pregnancy, around 4 kilogram fat will be getting stored in her body. That will be utilized for the development of the breast, and even in her body also fat will get deposited. And total energy cost comes around all these things. If you are considering, the total energy will be around 73,000 kilocalories. And in that 73,000 kilocalories, majority of the energy of fat she needs during the last 2 trimesters of the pregnancy. I told fat, it is not fat. Majority of the energy consumption will be coming in the last 2 trimesters of the pregnancy. So we can see the additional requirements. During the pregnancy, we are supposed to give additionally per day 300 kilocalories for the pregnant woman, and for a lactating mother in the first 6 months, 550 kilocalories we are supposed to give, and after 6 months, that is 6 to 12 months, we are supposed to give additional 400 kilocalories for the mother. Already I have told you that we are supposed to give additional 300 kilocalories during pregnancy and 550 kilocalories during the first 6 months of lactation. So here we are going to see the recommended daily allowances for a woman who is having sedentary lifestyle. So a person, if she is non-pregnant, she needs around 1875 kilocalories in a day if she is having sedentary lifestyle. And the same lady, if she become pregnant, she is supposed to take additional 300. So if you are adding these two things together, it will become 2175 kilocalories. So this is the energy requirement for a pregnant lady who is having sedentary lifestyle. And if you are thinking about the lactation during the first month, already I told you that additionally we are supposed to give 550 kilocalories. So if you are adding this 550 with the 1875, this 1875 is needed for a normal woman who is having sedentary lifestyle. So the total energy needed for the lactating mother will be 2425. The same situation if you are taking after 6 months of delivery, the need will be decreasing, and in that case we are supposed to give additional 400 kilocalories and the total need will become 2275 kilocalories. Next we are moving to the protein requirements for the pregnant and for the lactating mother. During the pregnancy, we are supposed to give extra additional protein for the woman for meeting the growing requirements of the growing fetus and for the proper development of the placenta and for the development of the maternal tissues. And we know that blood volume is increasing, amniotic fluid amount is increasing. For that also we need to have protein, and some amount of protein the mother will be storing. For that also we need to have additional protein during the pregnancy. So the additional requirements include, in a day we are supposed to give 15 grams of protein for the pregnant woman, and for the lactating mother in the first 6 months we are supposed to give 25 grams of protein, and after 6 months we are supposed to give 18 grams of protein. So if you are thinking about the same recommended daily allowances for a sedentary woman, normal case, that lady, if she is not pregnant, if she is not lactating, and if her lifestyle is sedentary, she needs 50 grams of protein in a day. And during the pregnancy we know that we are supposed to give additional 15 grams. So these two things together, during pregnancy she needs 65 grams of protein in a day. And during the lactation additionally we are supposed to give 25. So 50 plus 25, it will become 75. So the protein requirement for a lactating mother in the first 6 months is 75 grams. And for the lactating mother after 6 months, it is 18 grams additionally she needs in a day along with the normal recommended daily allowances. So the total need of protein will be 68 grams in a day. Next, we can see the iron requirements during the pregnancy. It's very important that we are supposed to give sufficient iron requirements, and the woman is not supposed to be in a stage of anemia. If she is anemic, her oxygen carrying capacity will decrease and the baby will be getting less amount of oxygen. So if the baby is getting less amount of oxygen, it will affect the growth of the baby, and even it will affect the brain development of the baby also. So additional iron requirement is needed for the augmented demand for fetal growth, for the expansion of maternal tissues. Even the blood volume also will be increasing. RPC amount also will be increasing, that we have seen in the normal physiological changes during pregnancy. For that also we need to give iron. And for development of the placenta, and we know during the time of labor process the mother will be losing certain amount of blood. So for meeting that blood loss also, for compensating that blood loss also, she needs to have additional iron content in her body. So the additional iron requirement is from the second trimester onwards, she needs 3.3 milligrams of iron in a day, and from third trimester onwards, she needs 5 milligram of iron. And usually, if you are giving iron in the food items, sometimes low absorption of iron only will occur when comparing the normal time. During pregnancy, absorption of iron will be less. So the recommended daily allowances to be increased by 8 milligram per day throughout the pregnancy. And during the lactation period, that is during the breastfeeding period, actually the lady will be having absence of menstruation. So the blood loss due to the menstruation, that we will be saving. So no need to give additional iron requirements, iron supplements during the time of lactation if she is taking normal amount of food. But it is very important that during pregnancy we are supposed to give additional 8 milligram per day. So if you are looking into the recommended daily allowances for a sedentary woman, normal case she needs 30 milligram of iron in a day, and during pregnancy additionally 8 milligrams we are supposed to give, and altogether the total iron requirement of the lady will become 38 milligrams in a day. And during the lactation period, already I told you that if the mother is having lactation amenorrhea, no need to give additional iron supplements. Only the thing you can advise her to take food items which contains more iron. Next, we can see the vitamin requirements. The vitamin A or retinol requirements for a sedentary woman is 600 in a day, and pregnancy, that is micrograms. Pregnancy, we no need to give any additional amount. The same amount will be sufficient during pregnancy also, but only the thing we should make sure that the woman is getting 600 micrograms in a day. And during the lactation period, that is from the first to 12 months, she need additional 350 micrograms. So altogether the need during lactation will be 950. And if you are looking into the other vitamins, that is thiamine, riboflavin, niacin, pyridoxine in milligram, the recommended daily allowances for a sedentary woman is the thiamine is 0.9 milligram, riboflavin is 1.1 milligram, niacin is 12 milligram, and pyridoxine is 2 milligram. And during the pregnancy, we are supposed to give 0.2 additionally. The thiamine we are supposed to give 0.2 milligram additionally, so the total requirement will become 1.1 milligram. And riboflavin we are supposed to give 0.2 milligram additionally, so the total requirement will become 1.3 milligram. And niacin also we are supposed to give 2 milligram additionally, so the total requirement will become 14 milligram. So the last one is pyridoxine. Additional requirement is 0.5 milligram during the pregnancy, and altogether this 2 and 0.5, the total requirement will become 2.5 milligram during the pregnancy. And in the lactation, in the first 6 months, additionally we are supposed to give 0.3 milligram, and altogether the need will become 1.2 milligram. Here riboflavin also we are supposed to give additional 0.3 milligram, so the total requirement will become 1.4 milligram. And niacin additionally we are supposed to give 4 milligram, so the total requirement of the mother during the lactation in the first 6 months of lactation will become 16 milligram of niacin. And pyridoxine, same, the requirement is same throughout the pregnancy and during the lactation, it is 2.5 only. In the first 6 months of lactation and later 6 months of lactation also it is 2.5. Additionally we are supposed to give only 0.5 milligram. And if you are thinking about the lactation after 6 months, thiamine additional requirement is same as that of pregnancy, that is 0.2 milligram. So the total requirement also will be same as like that of pregnancy, that is 1.1 milligram. And here riboflavin is also same, the pregnancy level, that is 0.2 milligram. Additionally we are supposed to give for the woman, so the total requirement will become 1.3 milligram. And niacin, if you are taking, the additional requirement is 3 milligram and the total requirement is 15 milligram. Pyridoxine already we have seen, it is same during pregnancy and during the lactation. During the pregnancy, the recommended daily allowance of folic acid is 300 micrograms in a day. So even if the mother is taking proper food also, it won't be sufficient for meeting the folic acid need. So it is better to give folic acid supplementation through the medicines. And ideally we are supposed to start this folic acid in the pre-conception period onwards. At least 3 months before the conception we are supposed to give folic acid for the woman. So it will be helpful for meeting her requirements of folic acid, and by that way we can prevent the neural tube defects of the open neural tube defects of the fetus. And during the lactation we are supposed to give 50 micrograms of folic acid in a day. Next we can see what will happen if you are not providing sufficient amount of micronutrients for a pregnant woman. See, the fetus is very sensitive to the micronutrient deficiencies, and it will affect even the organ formation as well as the growth of the baby. And it may produce, sometimes if the maternal deficiency is there, means it will not only affect the fetus, it will affect the mother also, and the mother's health also may get complicated. See, we will see the effect of these deficiencies on the effect of micronutrient deficiency on the mother and on the infant. Thiamine deficiency, if it is there, usually it will not produce much problems for the mother, but for the baby, there is a chance for infantile beriberi. And folic acid deficiency is there, means mother will get anemia and the baby will get intrauterine growth retardation, open neural tube defects, low birth weight and abortion. And if vitamin A deficiency is there, it will produce anemia for the mother, and for the baby there's a chance for low birth weight and premature birth. And if vitamin D deficiency is there in the mother, it may produce osteomalacia, and for the baby impaired bone development will occur, hypocalcemia will occur, and there's a chance for rickets also. And if vitamin E deficiency is there for the mother, it will not produce much problem for the mother, but for the baby it will produce birth defects and there is a chance for spontaneous abortion also. And if you're thinking about the calcium, there is a chance for hypertension if you are not giving proper calcium supplementation for the mother. Chance for eclampsia is there and chance for osteoporosis is also there for the mother. And for the baby, it may produce impaired bone development, hypocalcemia and rickets. And magnesium, if you are not giving proper amount, adequate amount, there is a chance for hypertension and eclampsia for the mother, and there is a chance for premature birth for the baby. And iron supplementation, if you are not giving, chance for anemia is there for the mother, and for the baby there is a chance for low birth weight, premature birth, and there is a chance for high infant mortality also. And iodine, if you are not giving sufficient amount, the lady will get hypothyroidism, and for the baby there is a chance for stillbirth, cretinism, neonatal hypothyroidism, and there is a chance for deaf mutism also. And zinc supplementation, it will not produce much adverse effect on the mother, but for the baby there is a chance for birth defects, premature birth, low birth weight and hypogonadism. So these are the complications that you can expect if sufficient amount of micronutrients if you are not providing during the pregnancy. So we can understand that it will affect the fetus very badly. So it is very important that we are supposed to modify the diet of a pregnant woman. And now we can see the diet during pregnancy. Already we have seen the requirements, and now we are going to see what they are supposed to take for meeting these requirements. You can advise the mother to take one extra meal. Usually if she is having the habit of taking 3 meals in a day, eating 3 times in a day, she can have one more, and allow her to encourage her to eat along with the family members, and you can encourage her to take more amount of fiber containing foods. You can encourage her to increase the intake of cereals, legumes, and she can include sprouted cereals, and more amount of vegetables and fruits also should be taken. And she can increase, if she is a non-vegetarian, she can increase the amount of meat, milk and egg. She can consume those things regularly. And if she is a vegetarian, we are supposed to insist her to take half liter of milk in a day, and additional pulses also she should take. And you can advise her to take groundnuts, soya beans extra in order to meet the protein requirements if she is a non-vegetarian especially. And fat diets she should not take, and you should give iron and folic supplementation regularly along with the diet. You should give that also, and you should advise the mother to avoid the drugs or medicines which are not prescribed, and she should avoid alcoholism and habit of using tobacco. And we can see the balanced diet for a pregnant woman. The food groups include cereals, fat, sugar, milk, pulses and nuts, fruits and vegetables. In the cereals, she can take rice, wheat, millets, etc. So she is supposed to take 300 grams of cereals in a day, either in the form of rice or millets or wheat. And fat, for that she can take oil, ghee, butter. Additional 300 grams of fat should be given. And sugar, for that she can take sugar or jaggery. Additional 20 grams is needed for the woman. And milk or milk products, she can take curd or something. 500 ml in a day should be given to the mother. And pulses and nuts, she can consume pulses, legumes, dry beans, nuts, for example cashew nut, badam, all those things she can use. So this requirement is 60 grams per day. Fruits 200 grams in a day. This you can give as like her preferences. And vegetables, she is supposed to take 350 grams in a day, and she is supposed to take 150 grams of green leafy vegetables, and other vegetables, more fiber containing vegetables, 120 grams in a day. And you can encourage her to eat roots and tubers 100 grams in a day, so that her fiber requirement also will be increasing. And now we can see the balanced diet for a lactating mother. Food groups items are almost same for the pregnant woman and for the lactating mother. And here also the items are almost same, only the amount is varying. That is, the cereals she is supposed to take 330 grams in a day, fat 30 grams, it is same, sugar 20 grams, milk and curd 500 ml, pulses and nuts 90 grams. Additionally, fruits 200 grams, vegetables 350 grams, green leafy vegetables 150 grams, other vegetables 130 grams, roots and tubers 120 grams. So that's all about the dietary changes or dietary requirements of a pregnant lady during the pregnancy. Along with that, we have seen the requirements during the lactation period also. Thank you for watching this video. See you soon with a new video.